we've also really looked at all the different hot topics out there from our network in Dental Circle as well as online, and we're hoping that we're going to cover a lot of these topics tonight with some of our panelists. Before we start, obviously it's really important for everyone to understand that it's going to be, whatever we say tonight isn't anything that's going to be guidance or anything fixed in stone. So if we do recommend or discuss anything that we're planning on doing, please don't hold it to us, because everyone's in the same boat right now. We're all trying our best to work out what's best for the future of dentistry, and we can only give you our opinions, and that's it. I'm going to start introductions of the panel now. So I'm going to go around the panel and quickly introduce everyone, and then we can start off with the presentation. So first, we've got Samir Patel. He is the clinical director and principal dentist at 11 Dental, which is a fully private practice in the heart of London. He also has a mixed practice in Henley, and is a very experienced dentist based around London. Jaswinder Gill is another principal dentist from a practice in Slough. He's also a clinical director for 2 or 3 orthodontic companies such as 6 Month Smiles and Invisalign, and also is a trainer with Ashinata of Ethical Selling. We've got Gabriella Puyo, who is the general manager for Bupa Dental, who everyone I hope should know by now as one of the biggest groups in the UK. They've got 484 practices, a mixture of NHS and private. We've also got Julian Perry, who's a commercial director of My Dentist, which is the largest provider of NHS dentistry in the UK, and he's also got 30 years experience in dentistry as a dentist himself. We've got Sam Whaley-Cohen, who's the CEO and founder of Portman Dental, which is the largest provider of private dentistry in the UK, with over 130 clinics across the UK. And we have Andy Acton, who is the shareholder and founder of Frank Taylor and Associates Group, which covers a wide range of services for dentistry, from everything from legal to valuations, brokerage, and wealth management. And finally, last but not least, we've got Miguel Stanley, who's a bit of a dental celebrity. He's based out of Portugal from the White Clinic. He's also the founder of So Dentistry and is a key opinion leader globally on lots of different topics clinically. So as you can see, we've put together a great panel here, and we're really looking forward to the discussion tonight. I'm just going to start the presentation. Give me 1 second. So first of all, just want to thank Dental Circle for hosting tonight's webinar. For everyone who doesn't know who Dental Circle is, I'm one of the founders and CEOs, as well as Amit Patel. We set up Dental Circle just over 5 years ago now, with a mission to connect dentists, hygienists, and all professionals actually across the UK in one network online. And we've got over 11,000 dentists now on the platform, and a few thousand dental professionals. So we've got a great network of UK registered professionals who can share, connect, and learn from each other, as well as create their own LinkedIn style profiles, which can help them find jobs and work with great practices. They also have a CPD and PDP log on there, which is a great way of tracking your postgraduate development, and also a downloadable CV function. And finally, to make it easier as well, we've also got a free jobs board on there, which is a comprehensive jobs board, allowing dentists in our network to essentially find great jobs on one platform for free of charge. So yeah, if you haven't got signed up to it yet, please do. But I'm sure most of you have already signed up to it, as we have most of the country already on the network. So let's get straight into it. We want to focus most of our time on the last few questions for the webinar, focusing on post-COVID. But I thought it'd be useful to start off with asking a few questions on what are the immediate actions that you have taken within your group or your practice when we were told to stop doing dentistry. And I think a lot of people have obviously already essentially put into action a lot of these different protocols, but it'll be good to kind of get a rough summary from Gabriella first. So Gabriella, do you want to kick off, please?
Great, thanks, Dev. So, I mean, you've mentioned it already, and I think it's top of mind for all of us, that the uncertainty and the lack of information and such a new situation that all of us were facing, and it kind of came very quickly. So I think one of the top things that we did that was very important was to just put a bit of order in terms of what kind of information was out there, what the good what sources were available, and put together a mechanism to be able to obtain that information, filter it, and enable quick decision making that could then be executed and implemented quickly. Always having a balancing act between perfection in the information, given the uncertainty, which was impossible, and the speed of acting. So a lot of times we had to act, and then things could change, or new information became available, or you realized that what you were implementing wasn't the right thing. So having the mechanisms to be able to implement and get a feedback loop and see what was working, what wasn't working, as you established and got to the new normal, I think was something that was very important for us. Creating new standard operating procedures and being able to roll that out to everybody. This is what good looks like under the new regime. To be fair, there were days when we had just finished updating the standard operating procedure and had to update it again. But having that, giving people the tools to understand what they needed to be doing at any given point in time across our network was another really big priority for us, and doing it as fast as we possibly could. Like I said, it was always a balancing act between having the right information, as much information, and being able to act as quickly as possible. I think that's something that you cannot do too much of at a time like this, no matter how big or how small your network is, really communication, because there's so much information coming at you at such speed, and not everybody uses the same channels, not everybody hears the same thing. So just continuously repeating, finding ways to get to people so that everybody is as aligned as possible in what you're trying to achieve is really important. The only other thing I would say that I think was particularly helpful at a time like this was to have really clear values as to what we were trying to achieve, which enabled us to set our priorities. They serve, if you have them in your organization, they serve as a way to enable you to make those decisions using those values and that capacity to prioritize about what's most important at this given point in time, or which direction should I be taking this decision in, to enable me to achieve what I find important, for my customers, for my people in my network.
Thank you, Gabriella. Sam from Portman, please.
Look, I think Gabriella covered a lot of really important ground there. I agree. For us, it's very much, or was very much, about setting very clear priorities. So that fell into three very clear buckets. The first was clear leadership. This is what we're doing. This is why we're doing it. And this is our decision-making process. So very, very transparent, very clear leadership. That was the first piece we want to be very clear on. I think the second piece for us that was absolutely essential was that we saw our role as to protect the people in the practice. So whether it's a clinician, a nurse, a receptionist, or a patient, to make sure that they were safe. And then the third priority was to make sure that we could care for patients. So making sure that those people we couldn't look after could still access whatever they could access, and whatever we couldn't provide in a physical sense, we could provide through the 3As. So very clear priority setting, very clear communication. I think the sort of second component, which again Gabriella spoke to, was that even as you were closing, to start think about what's going to be required to reopen. So what are those priorities around reopening? What are the gating items that say, yes, you can open, or no, you cannot open? And setting out those very, very clearly to help set out those priorities that needed to be landed. So I agree with Gabrielle. I think really, really important to set your priorities, and really, really important to fall back on your values. And for us at Portman, we said, as we always say, we want to treat people as we'd want to be treated ourselves. So putting everything through that lens, are we treating people as we'd want to be treated? And that's been a really important founding consideration for us throughout the whole process.
Thank you. And last but not least, Jazz.
Hi, thanks for inviting me first of all, and hello to everyone out there for taking the time out to listen to listen to us. What I wanted to start off with is, just especially aiming at the associates and the principals out there, is basically because this has all happened now. This all happened over a month ago, and I was more about surviving the short term so we can thrive in the long term. So that was the key aim that I had with my whole team. And the first, so we wanted to run a sort of step-by-step approach in terms of exactly what we did. So as soon as we found out, we wanted to notify all of our patients. That was done by newsletter, social media, Google listings, website, all of that was updated. Once that was done and the patients knew exactly what was happening, we wanted to have a clear remote support triage system. So that we could still help the patients because patients were constantly ringing in. We wanted to make sure our phone lines were open. We can answer all their questions because patients are still going to be in pain. That's not going to stop. So we had to direct them exactly what we can do for them and tell them when they are ringing in. We had to identify team members required for furlough and communicate with them appropriately because one of the practices, for example, is 2/3 NHS and 1/3 private. So we had to work out that which team members are going to go for furlough, which ones aren't. Then the ones that are staying, we have to have a remote working plan for those members that are still remaining on board. And that included a safe maintenance of equipment during the shutdown period. So what's going to happen to the practice? The last thing we want, we didn't know how long this was going to last. So we made sure that the equipment in the practice is going to be maintained as well. We also reviewed teams' annual leave and determined if there is scope for this to be used during the shutdown period. We looked at staff and members and looking for temporary short-term working reduction of hours. And the other thing is that we wanted to continue the service provision. So had a lot of associates, principals, and lots of dentists out there that stopped their marketing. That was the last thing we wanted to do. We actually did the reverse. We increased our marketing. We wanted to stay in constant communication with the patients and they could stay in constant communication with us. The reason is because this is the time that they're going to remember. A lot of patients have phoned me with triage patients and they've said, my dentist is shut. All I'm getting is a machine, nothing else. So that's why communication is really important with those patients at this time. So not only are you communicating with your patients, but patients of other practices as well. And last but not least is the team and looking after the team. My role should only be to look after the team, really, because the team are the ones that are going to look after the patients, and the patients will look after the business, and the business will look after me. So it's like a circle. So we made sure we have constant Zoom meetings just like this with the whole team. If anyone's got any concerns, anyone's got any questions, we can answer them. We've got a WhatsApp group so everyone can communicate with everyone. So we made sure all of those steps were taken as soon as shutdown occurred.
Thank you, Jazz. That was a really good summary there. Yeah, I think the key thing here is communication was a key, leadership, and I think making sure, especially if you've got an NHS contract, that you've got some sort of way of talking to patients, triaging them and ensuring that you've told them where to go, because as everyone went into panic mode, it's really important, especially as healthcare providers, that we give that guidance to our patients so they know that where they can go to for care. So next question, what are the best strategies to survive financially through lockdown? So first up for this one is Samir, who obviously runs a fully private practice. So Samir, do you want to give us your input, please?
Yeah, so what it says is really strategies to survive, and that's really what it was, because I think this is a modern war that a lot of us wouldn't have been in the war, but this is a very different time for all of us. And the way that you deal with it and the way leaders deal with it, the way Jazz spoke of talking about his staff and Sam and Gabriella, that's absolutely paramount. So the safety of everybody was very, very important, from the patients through to your own workers, through to yourself. If you're not well through this, you're not going to be able to lead your staff and your whole practice through it. And then it was the case of just hibernating a practice. You know, you've grown a practice over many years. You've almost hibernated it within 2 or 3 days. And that's really sort of heart-wrenching and a tough thing to do when you put a lot of effort into growing a business. You don't know when you're going to open. I think a lot of us feel like we're on summer holidays, not knowing when it's going to end. And so that hibernation process was a real kick to the system. And it felt like it lasted for about a week, where we were just reducing overhead. We were looking at forecasts. We were looking at exactly what our cash flow would be like if this lasted 1 month, 3 months, 6 months. And then the knee-jerk reaction of, is there an insurance? And I think that's something that if you've not looked at your insurance and you've not joined the Facebook group that Laith Abbas has set up, I think that's very, very important as a practice owner, whether you're NHS or private. Please do that, because there are many of these insurance suppliers saying that you're not covered. And actually, I think you may be looking at all the knee-jerk reaction that's going on. So that's just one little bit of advice. And then it was a watershed moment, as I said. You know, as a leader, you know, when the wind blows, the leader will then sail the ship in a different direction. And so there was the whole mantra that I have is being a great dentist, and being is very much being in the present and understanding where you're at. Great is going to be something you put on yourself and how you believe what greatness is. There's a lot of great webinars at the moment in terms of education, and dentist is the safeguarding of your patients and the caring nature of the reason why we all came into it. So all those three points are really crucial when you say, what are we doing? What's our strategy? And Gabriella, you sort of said mantra, and I think for me, that's our mantra, my mantra, of trying to understand how this is going to work at this watershed moment. And I think we'll speak with the number of questions we have about how we're going to sail that ship, either individually as practice owners, but also as business owners and corporate owners as well. I look forward to hearing everybody's views on that.
Thank you, Samir. Julian?
So, yeah, good evening, everybody. Thank you for the opportunity to be part of the panel. I'm going to answer the question in a slightly different way, in a sort of slightly more pragmatic way. I agree with everything my colleagues on the panel have said, but in practical terms, I'd suggest the following. CPD, get it done. Right? There's no better time to actually do your online CPD and make sure you cover off your CPD. At my dentist, we've opened up the academy to everybody, so you can sort of get in there and log on if you choose. In terms of strategy and how you survive financially, it's been very interesting. I've done an awful lot of work with a number of DSOs around the world now, and it's fascinating to see that in the UK, that at about Monday of last week, approximately 34% of all practices in the UK were thought to be illiquid, as in financially unable to continue to survive and moving into overdraft level. And that's quite an interestingly short time period. I think because we've never been in this situation as a profession before, I think there's probably one of the learnings that comes out of this is that many of us will have been financially overexposed, and I think one of the certain recommendations I'd make is to reflect on your cost base, both personally and professionally. A lot of people seem to have got into a lot of difficulty very quickly. And whether it's a pandemic or whether you break both your arms and legs skiing, as I know a friend of mine did a couple of years ago, which crippled his practice, I think contingency planning for something like this is something that we should consider. Later, I think, Dev and I were chatting about this, there'll be the phases of return. I mean, I called them DEFCON 1 to 4. But we call them now stages 1 through to 4. So stage 1 will be immediately post-COVID, and what does that look like in terms of patient volumes, patient flow, the burden of PPE, aerosol generating procedures, etc. I'm not going to go into that now because I believe it's part of the presentation and the discussion later. But there will be phases of getting back to work. It won't simply happen that you flick a switch and on the 1st of June or the 1st of July you'll be back to business. So I think you need to think about that, and whether a principal or an associate need to take a really good look at how you think you might operate going forward through those stages. You know, PPE costs will have increased. It's interesting, if you look at those that have gone back in countries around the world, China, South Korea, etc., those that have bounced back fastest have been those that have engaged with technology. And what I mean by technology is webinars and communication to patients, not colleagues, media messages, the use of social media, Instagram, Facebook, you know, you name it, in communicating with patients, video triaging and video diagnosis, video consultation for those patients still too apprehensive to come in, but still perhaps wanting to know about implants or aligners or cosmetic, etc. So you have to reinvent yourself, and you have to think, I think, outside the box and say, well, volumes will be down by view of social distancing and the limitations in volumes through the practice and the burden that PPE will put on us. So how can I change my working practice to be able to accommodate that? I think without taking any further time, I think it would be sensible to appreciate that it's likely that there will be a new normal. I don't think any of us really know what the new normal is, but I think it would be incredibly complacent to believe that, you know, by September or October, we will have forgotten about this, because I don't think, personally, I don't think from what I've seen and what I've reviewed that that's going to happen.
Yeah, no, I completely agree. Thanks, Julian. And Sam? Oh, you're muted. 1 minute.
Perfect, thanks. Don't get me off mute. So look, I agree with what the panelists have said. I think a couple of other pieces possibly to focus on. So Jaswin was saying we are in an ecosystem, and that is absolutely true. So when we were thinking about surviving financially, one was obviously to understand the cash flow and how that moves, and how to make sure that we have the cash on the balance sheet. And so that was obviously an immediate priority. I think once you've got that covered and you're comfortable that you can survive almost whatever scenario, your priorities very quickly move to other things. So I think for me, that ecosystem came back very quickly into focus. So the first one was, look, how are people responding to this? How do we look after our people? And there are various components to that. So for colleagues, maybe they were able to take advantage of the job retention scheme, or if they were in the NHS environment, take advantage of being employed to do whatever they were doing. But to try and ease that uncertainty, to give people clarity about the security of their jobs. So really, really important. The second bit was to try and think about the cash flows for our clinicians. So saying, look, there's some real hardship out there. This isn't just about the practice owner or the group, but actually the people we rely on to deliver the dentistry. So how do we look after our clinicians? And so for Portman, we've done a number of things, whether it's about making sure we can release whatever cash we can to clinicians, or in our example, we set up a hardship fund for anyone within the group who's suffering real hardship, and that's being funded by people within the group. So many of the management team giving up some of their salary to put money into a hardship scheme to provide for people who might be having a hard time. So to lead from the front, to sit with our values and go, it's not just about us as a provider, it's not just about an individual practice, but about the whole ecosystem. How do we look after people who are also having a hard time? And I think the third element of that is, as a predominantly private provider, trying to understand the sort of asymmetry in the market. So where the NHS have funded practices to not to keep or funded them, and for private practice to lobby very hard to say, actually, this is a very strange environment. This is a very market distorting environment. And how can we look after the clinicians? So whether it's access to self-employed benefits, so I forget the name of the government scheme, but what elements of government support are out there? How can we make sure people are aware of them? So we've done things like seminars with partners at Deloitte or at legal firms who specialize in employment, to say, these are the things that you can get hold of, make sure that you're proactive on them, and let's lobby, let's go to our MPs, let's go through the ADG, let's make it clear that there are things happening in the market that fundamentally threaten the mixed economy that we exist in. And that's distorting, but also has very long-term implications. So how do we respond to that? So our response in terms of surviving it from a financial perspective, very quickly moved from, actually the company as a whole is safe, how do we look after the people? And that's been our real priority.
Yeah, thank you, Sam. Yeah, I mean, it will also be interesting to know what have you done about patients who, dentists who typically get paid from plan patients. Has that been passed on to dentists, and how does that work? Because I think that's the only component that's coming in as a private practice owner or as a group.
Absolutely. So yeah, so we very early on took the decision we wanted to pass on as much as we could. I think the complexity within the membership payments is ultimately you're not able to provide the service people are paying for. And so there is a risk that patients might turn around and say, actually, I'd like my money back. And we see lots of examples of that in gym environment where they're saying, actually, if I can't get access to it, I'm not paying for it. So we took a view, look, we'll pass through 80% of your payments and make sure you have that cash flow. We're going to hold back 20% to provide for refunds if we need to do that. We do need to deliver the hours that patients have paid for, so we need to commit to doing that. But once we do that, we'll make sure that that 20% gets passed back to you. So our position was, we really want to look after people. We really want to make cash flow available. We of course have to balance that against what the patient's expectation are and the patient's needs are.
Yeah, no, that's really good. And I think that's a fantastic way of helping out patients, dentists right now who are obviously in the private practices where typically they don't get any kind of money from the NHS. I mean, there's a big kind of struggle right now between practice owners trying to keep the business alive, even with mixed contracts, and obviously associates trying to get some income to stay, afloat as well. But as Julie mentioned, I think this is a really good time for all of us, young or a bit more experienced, to really look at how we manage our cash flows going forward. Because I think, as Julie mentioned quite clearly, it's a large number of people, practices in the UK, 34% are potentially going to go in liquidation because they can't, survive the kind of decrease in income, which is quite surprising. If you look at any business, they should be having some sort of a buffer there and not be so over leveraged. But yeah, I mean, basic things that we did in our group, which is mixed practice group, was looking at all of our balance sheets and seeing what direct debits we can stop, how we can sort some suppliers and banks and loans to see how we can push them back a bit later. So just basic things like that will make a big difference. So anyone out there who hasn't done that yet, it may take a bit of time to go through it, but it's worth waiting gold to give you that extra few months that you might need to really give you that time to put up your balance again in terms of your income and your cash flows, because we don't know how long it's going to last for the lockdown. We're hoping it's not going to be more than a month, 2 months more in terms of the dentistry side of things, but no one knows. And I think it's really important to be really cash savvy now and ensure that you put your business first, as well as your teams, because otherwise when you come back to work again, there's nothing else there. So yeah, I think there's some good points there made.
Dev, could I just make a couple of points as well? I think your point about communication with suppliers is critical. I think communicating with suppliers and trying to defer payments as much as you reasonably can makes eminent sense. But I think there's two other elements as well. There's the government CBILS loan, the Corona Business Interruption Loan Scheme. And I saw a survey from the BDA just 2 weeks ago where 73.9% of practice owners hadn't applied for a loan. And they should, because you just said, we don't know how long this is going to run on for. And the last thing you want is a situation where you run out of cash. So if you can arrange for a loan, get your application in and have that money, it provides you with a buffer. You can borrow that money for up to 2 years, no capital, no interest repayments, and you can repay it back without penalty. So if you've got the money, it puts you in a stronger position. And just yesterday, the Chancellor announced that there's going to be a £50,000 bounce back loan available as well. So people should definitely look at those two things, because they could definitely help them in terms of a strategy to get through financially.
Yeah, definitely. That's a great point. Thank you, Andy.
Dev, could I just add one thing to that? Because I think there are going to be a lot of, we've got a view of obviously all the way across the board, but as private practice owners or a business owner, I think there's two costs. One are your fixed costs, and you can't obviously try and change those, but it's still worth, like you said, writing to your landlords and seeing if you can get some sort of reduction, writing to your local authority to see if your rates can be reduced. You might even want to be as bold as what we have done and stopped our direct debit. And if they do come back to us, well, okay, we don't mind paying it later on. But these are all the strategies that you've got to take to actually survive in this very difficult time for some very difficult businesses. You'll have the banks, and I know we've spoken about that very briefly, but also there are some great providers. People, and I don't mind saying, SOE have reduced from 300 to 93, Microminder, 3 months free, code 2 months free. So if you've not done all of these things to reduce your overheads and your what I call the variable costs, please make sure you're onto these suppliers as soon as possible for all of your variable costs, and see if you can get some sort of reduction or some sort of holiday. And you'll find the actual overheads that you're putting out on a month-to-month basis will be massively reduced.
Yeah, no, great point, Samir. And I think everyone should have done that by now, hopefully, or be doing it soon, because it's a really simple thing to do, but it makes a huge difference, and it gives you a much longer lifeline, which is, I think.
Can I just mention something? I know we're sort of many points in this question. I probably get a message or an email at least once a day. When you say cash flow forecast, what do you mean? There are so many dentists that don't do that out there. The first step that they should be taking is making a cash flow forecast. If they are going in the red, then like Sam said, send a blanket email out to all of your suppliers. We've had the same reductions with SOE, the rent, if you've got a virtual receptionist, even we've got filtered water. All of that can be cut off because you're not using it. So send a blanket email out, because if you don't ask, the answer is always going to be no. And then from your cash flow forecast, you can work out how many payment holidays do I need? Who do I need to approach for the payment holidays? And then you know you're not going to go into the red. So you can do that at 3 months, at 6 months, and all the way through to 9 months if it lasts that long. So you know you're going to be okay. And the second point you mentioned about private income. Private income doesn't have to stop. I know there's a lot of private practices out there. We do, as you know, we do a lot of Invisalign. We are still, the patients that are still mid-treatment, we're posting out aligners, and the patients that pay monthly, because they're getting more aligners, we're still getting private income coming in from those patients. So it doesn't mean your private income has to stop. Yes, we're getting our NHS income, but we also, in our cash flow forecast, take into account the private income that we're getting. So it can be very easily done. You just got to put your mind to it.
I completely agree. Yeah, great point.
Just a perspective, which I think is sometimes the difference between some of the larger groups and some of the smaller practices. I think, as we mentioned a few times, we are in an ecosystem. So a lot of the bigger groups that are better financed, I know, have actually stepped up and spoken to their suppliers and said, actually, we're not going to look to end payments or to bring payments back. We're actually happy to help support you through your through this period of shutdown. So I think it's really interesting, the idea of, yes, preserving your cash flow, but we do all work together in the end. And I know Portman, amongst others, have been quite proactive in making sure that payment terms actually don't put other businesses under undue stress. So it's an interesting balance to strike between the two approaches.
Yeah, no, I think that in the end of the day, there's obviously the bigger groups who've got the cash flows to kind of to keep their kind of payments going out, which I think is great, because that's helping the suppliers that we potentially use as smaller practices or groups or individual practitioners who can't handle the kind of cash flow now, to essentially keep their suppliers in business. So I guess they're funding them for us, which is really good. Thanks, Sam. Cheers. All right, next one. So how to best make use of your time during lockdown. Now, I know everyone's been sitting at home and probably twiddling their thumbs, wondering what to do, and probably listening to webinar after webinar. But I think as business owners, there's some really good things that we should be doing. And let's hear from the panel and see what they've been up to. So what we'll start off with is, let's start off with Samir, please.
Dev, one of the things we've spoken about already is leadership. And, I think the first thing we did was set up WhatsApp groups. We've done Zoom calls with our staff, with our clinicians. I think as a leader, you have to reduce anxiety. There's a huge amount of anxiety. Someone like Sam is speaking with reduced anxiety because of the position he's in and the corporation side of things. And then you go all the way down to people that own one practice or an associate, down to people who are employed. And so therefore there's a wide variety of anxiety out there, and everybody's going to be different in that. They really are. And the way they respond to that is going to be very different. So you've got to show a true, every practice owner or every leader has got to show a teammanship style. And that's exactly what we're talking about, and other people have spoken about through this. You're going to have to change your policies for your cross-infection. You're very much going to have to then spend some time at home with children, but like we said before, be in the present. When you're at home, let that phone be away, spend 100% time with your family. And I believe the final thing is brain power. We've got a huge opportunity not to let ourselves disintegrate or fear or have any of that anxiety I spoke about at the beginning. It's actually grow yourself so you're stronger when you come out of this. Now, any practice principle, when we start, I know we joked when we first came online and we saw there were 1,000 people already on board in the first minute of this broadcast. We actually said that, but that's what our practice is going to be like. It's going to be so busy. So we need to be rested. We need to be ready. We need to have strategies, and we need to be absolutely strong for when we go back. And because everybody's going to be looking at us as practice principals to how is the ship going to be sailed? And that sailing of the ship will come from one person or a few people who are in charge of that practice. And it might come from a corporation. And I think the reduction in anxiety during this period and the growth of oneself is absolutely important.
Thank you, Samir. And that was some really, really good points. Gabriella?
Yeah, I agree. Some very good points. I think during the lockdown, I mean, there's still a lot to be done. I mean, I don't know about you, but I always have a huge list of all the things that I wish I could get to, but I never have time to. And now is actually a time when we have time to get to some of those things that we always say we're going to get to. So on the one hand, I would divide it into buckets about how to best make use of your time during lockdown. The first bucket for me is the most important, is that we still have customers. Even though they might not be able to necessarily come in, they will have problems. So being able to provide that telephone triage to alleviate their nervousness, their pain, whether they be in the middle of a treatment and not know what to do or what's next, or have the uncertainty, or have a dental emergency, and point them in the right direction. I think that that is probably one of the most important things that we need to be providing during this lockdown, because there is that anxiety out there. Next, the second bucket is all of those things that if you are in practice that you've always wanted to have, to get done, now is the time to get it done. And even just dumb things like putting in order the molds, or going through your paper records and putting them in order, and things like that. They're very important, and they're always the things that you leave to the end. Mandatory training, CPD, it's already been mentioned. There are lots of things that we can do in the here and now to take advantage, to get prepared, to put ourselves in, the best possible position to go forward. And I also agree with Samir that keeping our people as healthy mentally as possible during this time, because there is a lot of anxiety, providing tools to your people, keeping them engaged, communication, but also providing them tools so that they can, they can take care of their own well-being and their own mental health during this time, I think is also a very important element. And that's the second bucket of the things that you can take advantage and get done now that you have a bit more time. And then the third bucket that Samir also mentioned, obviously, is get ready for the future, because as Julian said, we're not going to go back to how we did things in 2 weeks' time. The world is going to change, and the more we can do to think about what are the elements that are going to change and what do we need to do to be prepared for that change, whether it be starting to think about the new standard operating procedure, what new infection control mechanisms are we going to need, how are we going to be getting the PPE that we're going to be needing going forward, what are our customers going to want, what kind of marketing are we going to want to put out there. So everything that we can do to be prepared, now might not be the time. But part of thinking about this is, what are the triggers? What are the moments when you need to start putting this in place? And, I was on this call the other day where Denmark went back to normal dentistry. I unfortunately don't think that's going to happen here that quickly. But all of a sudden they were like, oh God, we're going back to routine dentistry next Monday. And this was like Thursday, and they were all nervous about, we don't have everything ready to be able to go back. So, part of the uncertainty is that time, which might seem like it's stretching out eternally in front of us right now, might go like this. So it is, look at the opportunity that it brings you to be able to do, all of the things that you've always wanted to do and prepare for the future.
Perfect. That was really good, Gabriella. Thank you. And last but not least, Sam.
Well, I think I agree with Gabriella. I could get up in the morning, not go to sleep again till the following week, and still have a lot to do. So maybe I'm just a busy fool. I'm not sure, but I agree. I think it is around prioritization and trying to come back, making sure that you are ready and ready for a new world, because it is clearly going to be a new world. So being out in front of that is incredibly important. And whether it's listening to what's happening in Asia and trying to get first-hand perspectives, whether it's talking to groups across Europe and trying to get first-hand perspectives of what that looks like, whether it's making sure that you have a supply chain that's well stocked, well diversified, is secure, is going to have the appropriate things in practice for when you want to open, whether you've actually got your SOPs in place and your triage in place and what your appointment books are going to look like. It feels, for us anyway, not like we're coming back as Portman of February 2020, but Portman of 2025, thinking really about how to completely reinvent the business, come back with turbochargers and as a digital business to the analog business that a lot of dentistry has been in the past. So I think it's a chance to really accelerate a huge number of incredibly exciting projects, whether it's about technology, training, talent development, career pathways. There's just an enormous amount to do. And of course, we're all super busy in our day-to-day. So it's often very hard to stop and think, if we stopped, we'd do this. And how many times in our lives do we say, you know, if I had the time, I would do this? I mean, in Portman's case, we've grown 50, nearly 60% a year, every year for 10 and a half years. That means there's an awful lot of stuff you'd like to stop and get done. But of course, that's not how it works. So we've tried to look at this as a big opportunity. And the analogy that we've been using is the Bubba Gump boats out of Forrest Gump. And we say we've weathered the huge storm. We've been out at sea while the storms raged around us. And now we're really sitting back in port, waiting to get back out there and catch some shrimp. What does that need to look like? What does that really mean? And so I think it's super important to focus on your priorities and get ready. That's a real key for us. Yeah, no, I think that's a great summary. I think from my perspective as well, this is probably the only time I know I've ever think of that everyone can just sit back and reflect. And I think it's been a great exercise for us to have that time to do that with our teams, to do training and to really look at businesses and see how can we change, reinvent and advance our businesses going forward for the new normal, but also what can we do that we missed out, Gavin mentioned, that things you've always wanted to do but you never had the chance to do on your to-do list. So I recommend everyone out there who hasn't done this yet to please do this and really look at what things you can be doing in this spare time now, because when we do start again, as Samir mentioned, it's going to be gung-ho, all kind of guns blazing when we go back to work again and trying to really kind of get back to normal again as soon as possible, if that's possible, if ever. Anyway, next question. So I think these are the kind of key questions here now, which will really start to test some of the panel. So when can we get back to work and what will that look like? I guess to go first on that one. That's a good one. Yeah. Studio, do you want to start off, please?
Did you say me?
Yes, please.
Marvellous. We don't really yet know when we'll get back to work. If you listen to people more intelligent than me, some people will start to have the conversation about phased relaxation in a couple of weeks' time. We haven't had any clear guidance as to when dental surgeries will be permitted to go back. But I think what we should be doing, because what it looks like will influence what we should be doing. And I've got very clear views on this. For those of you who know me, you know I've always got clear views, which sometimes a good thing and sometimes not. I think one of the key things that people will need to focus on, I believe colleagues will need to focus on, is properly planned triage as you get back in, and what will that look like? And triage will need to be done the day before the patients come in, and the triage will need to be properly scripted, the information to be gathered, properly assessed for the right reasons, not only about the patient's dental needs, but also about COVID experience. And I know Dev's got a couple of slides on this, so I won't go too much into that. But the pre-screening of patients entering the practice is probably singly the most critical way of keeping staff safe. I think when you come back into practice, it's our estimation, and I say our, the truth is mostly mine at the moment based on the information. I've spent a lot of time looking over the last 3-4 weeks looking at the European DSAs, the American DSAs, specifically from start to go back in China and North Korea. And there are some clear patterns coming out of this. So for example, you'll see a figure banded that 90% of dental practices about 7 days ago were working in China. What you didn't see in the statistics is only that 10 to 12% of the dentists have gone back. And also, when you look at the data, we need to appreciate that because the workflow in the practice will be different in terms of going back when social isolation is still in place, for example, there will be patterns of progression through the practice which will have materially changed. Those that have gone back more successfully than others have spent a huge amount of time communicating the new way to their patients, either in webinars, video consultations, and I think those that embrace video consultations, particularly for their patients, either in triage or for use of a crass word, pre-selling of things that the patient might be interested in, is certainly something in China that's seen a significant and impressive increase in patient interest. I think the patients will, and I'm going to get to the point now, the patients will and should be phased through the practice, particularly if we go back with social distancing. So social distancing will still apply in the reception. You'd expect the receptionists to have things like screens. There's a whole debate around PPE, which I don't really want to open up now unless pressed, because I think it's also coming in part of this presentation.
Yeah.
I think, and the other thing is, if you look at phase one of getting back, if you take the lead from other countries, the waiting room is not used, the air conditioning is not used. Most places throw the windows open. If you don't have windowed surgeries, there are other alternatives to decreasing viral load. And again, hopefully we'll touch on those things. And when you get back, you need to look at aerosol generating procedures, the use of rubber dam. There's lots of discussion about hypochlorite mouth rinses to decrease viral load. I think the other thing to consider is if you've got a 4-surgery practice, I think on the first phase back, you won't have any more 4 patients coming at 9 o'clock because you want to avoid congestion in the waiting room, or because you're not using the waiting room, or reception. And what a number of successful clinics are doing is phasing the patients very specifically, and that's why communication is very important. So patient A comes in at, let's say, 5 to 9, patient B 9, patient C 5 past 9, patient D 10 past 9. So you don't have congestion, and the medical history screening and the pre-screening will have been done in the triage the day before. So this is practically a walk-through. There's lots more to discuss in this, but that's how we believe that phasing and staging. I think in terms of economic success in the practices, again, based on the information that's available, with PPE, with staggered appointments, with aerosol generating procedure concerns, with a general slowing down of patients coming for recalls, particularly, because if you think about it logically, are you going to go straight out of COVID lockdown for a dental checkup if you don't have a problem? The evidence says not. What you tend to see coming back from the practice is patients that require treatment. So all of these things need to come into the mix. So what does that look like in practical terms? Probably revenues at best. We'll get to maybe 25, 30% in the first month going through and then phase up. I don't know that. I'm not an authority on this. It's a distillation of hundreds of conversations in the last 4 weeks with people in different countries and different phases of getting back to work. So I think we will get back to work, and I think there's 2 lights at the end of the tunnel. I think, because everyone looks at COVID like it's sort of leprosy. The reality is the COVID virus has existed for 16, 17 years. The COVID-19 is a species jump, which is what's caught us all off guard. The reality is, in actual fact, we need herd immunity. So we actually want people to get COVID-19. We want to get COVID-19. And the challenge has simply been medical resources to be able to deal with the spike. That's the reality of where we are. It is more brutal for some people, but people seem to also forget that approximately 80% of people get through it without having the awful consequences of needing to go to hospital, or sadly loss of life, or the requirement of ventilators. But we will get to that stage 4. And at the other side, and the last tiny bit I'd like to put in, just to try and take a little bit of heat out of the stress here, is that there's quite a lot of research being done comparing a COVID positive patient who coughs in your face versus an aerosol created in a dental procedure. And the viral load in the aerosol is very significantly less, which is backed up by those countries that have gone back are seeing no increase or no elevation in COVID infection in dentists as yet compared to the wider population. And I think that's probably enough for me to say at that moment.
No, that was fantastic. Thank you, Julian. Miguel? Oh, sorry, I need to unmute you 1 second. Yeah, go for it, Miguel, sorry.
Hi, well, thank you so much for having me on this panel, Dev. So I've been listening to all of the panelists. I'm very, very impressed by the brain power, and I have to agree with everything I've heard up till now. Very, very interesting. So basically, I think I'd just like to start saying that I think it was an absolute disaster to shut down dental practices during the COVID outbreak globally. I think that the UK have made a grave error in not thinking that dentistry is at the forefront of medical attention. Once again, we've lost the fight to stand up to not be the poorer cousin of doctors. I think that not being able to take care of primary issues, abscesses, acute pain, the broken dentures, and all the huge array of problems that can happen from a patient perspective, not being able to do that clean, it didn't happen in the UK. France also put a lot of difficulties with that. The UK, the US, many states as well. In Portugal, where I practice, we were allowed to stay open for emergency dental treatments, and that was subjective to a relationship between the patient and the dentist. So I think the UK is going to see a huge, and not just that, globally, clinics are going to see a huge surge of failed treatments, like people that were doing guided bone regeneration or implant cases or temporary bridge work, so on and so forth, that dentists that were doing, big cases, this 2-month lockdown without patients being able to maintain their cases, who's going to support the financial loss when the, patients finally return to the practice and they've got broken temporaries, broken bridge work, failed implants, so on and so forth. We all know the delicate dance it is when we're doing these complex cases. Orthodontic treatments that, were being done halfway through complex bone regeneration. I'm talking, complex cases. There's going to be a huge financial burden on practices. I haven't seen anyone so far discuss that. And I just think that collectively dentists really need to stick up for dentistry. And I was on a webinar with Dr. Markus Strolch from Germany, and Germany pretty much remained open throughout the outbreak. And Sweden as well. We've seen the case in Sweden. I've been talking to a lot of practitioners in Sweden, and again, the numbers are very, very low of people getting infected. Of course, if that happens, things have to shut down. But they're keeping business open, and they're still maintaining, let's say, their workflow. Of course, people aren't coming in for cosmetic works and stuff. They're using a certain measure of let's say, good sense. But so I think that was a big problem. And I think that around the world, this is a great opportunity for dentists and dental companies and insurance companies and all of us to get together and say, look, dentistry is very important, because if you've taken care of your oral cavity, you actually have a stronger immune system, you're eating well, you're less stressed. And if you do get COVID, you actually have a better chance of fighting it. So I think that I'm really saddened to see how a lot of governments really relegated dentistry to a non-vital or critical role. So that's the first thing. Getting back to work, I agree with, we've done online triages. We're eliminating for the next month the front desk. So the receptionist prepayment online. Everything is done online. To be clear, I run a private practice for those that are just joining now. So I've always seen a lower volume of patients per day. And for 20 years, we've had a maximum of 1 patient per hour in our practice. And we'll get into slow dentistry later, but I've always believed, because I come from the AIDS generation, and I've always been petrified of catching HIV from aerosols and from, I'm a surgeon, from surgery. So we've always, even in the basic treatments, simple extraction, a simple filling, we've always been acutely aware of the contagion possible in aerosols. So having said that, we've invested in ERG-YAG lasers that have been proven to have a lesser quantity of aerosols, which can be used for restorative, for surgical, to reduce bacterial load. Moreover, I think it's very important that people understand that hygienists and dentists that are practicing alone, when they're using the ultrasound or any turbine, whatever, will not have the capacity to activate the surgical aspirator, doubling the quantity of aerosols in the room. So perhaps people have to start thinking about 4 hands for everything across the board. Because if you are generating aerosols, you need to have a second person in the room helping with the aspiration, and that's going to heighten costs. I speak for myself. We've always had, even our hygienists have a full-time assistant and have for 20 years. So we've, very responsible lowering the aerosol. So there are some interesting associations that have put out free STL files for those that have 3D printers that have like a mouth opener with a special adapter for the saliva ejector to fit in, for some companies that don't want to invest or cannot invest in a second set of hands. But I think having an extra set of hands during the next few months is going to be critical at one, protecting the practitioner, the dentist or the dental hygienist, and also the patient. I think that's something that should be considered. Also, HEPA filters. I think these things are huge discussions. It's also a great time to invest in cleaning up your air conditioning systems. A lot of people forget about that, but we know that Legionella is an actual real illness. Not that nobody's talking about it right now, but air conditioning systems do need constant maintenance, and the HEPA filter systems, we've invested in those as well. Getting back to patient screening, 100%. We're reducing. We used to want everybody to come to a first appointment, and let's say 50% wouldn't stay because they couldn't afford the treatment proposed. We're now doing that screening online. The only thing we do, all of our patients, before they get a full complete diagnosis, are required to have a CBCT, cone beam computed tomography, which we've been using for a decade now. Otherwise, we can't give a full medical assessment of the patient's oral cavity. And so what we do is they will come in at a specific time to do their CBCT, go back home, and then the online consultation is done. So by the time they come to the practice, as Jeremy said, everything's been streamlined. They don't contact other patients in the waiting room. We're asking them to wait outside. They can stay in their vehicle. And again, a reduced amount of patients, at least for the foreseeable future, till things calm down, till herd immunity is acquired. We have individual PPEs for every patient coming in for our team. And again, to resonate what a lot of the panelists have said, I want my team safe. My team needs to be safe. So we now have 2 teams. We'll have a team working in the morning. We'll have a team working in the afternoon. They will never cross. Moreover, the cleaning team in the morning and the cleaning team in the afternoon at the end of the day. And also our in-house dental lab technicians will not meet each other. And I think it was Tom was talking about digital. We're a fully digital practice, so also reducing the need for chair time by investing, and all of our team have been heavily trained in digital processes. We're now also believing that digital dentures will be making a huge comeback, very affordable, very fast, very easy for those that won't have the equity to invest in expensive implant. I think we need to focus mostly on treatments that reduce chronic inflammation in the body to improve the immune systems, that get rid of infections, get rid of cavities. I think that's going to be a huge thing moving forward. And again, I can't stress this enough. protecting our teams, our associates, the people that work for us, because if they're safe, then we can provide for the rest of us and do safe dentistry. So just in a nutshell, fewer patients moving forward with a minimum of a 10-minute turnaround per chair per patient. If you can do your dentistry in 5 minutes, fine, but that turnaround time needs to be maintained.
Thanks, Miguel. And lastly, just because of time, Sam, do you just want to give us your thoughts on maybe focus a bit more on when do you think we're going to start back to work again, and what kind of changes do you think we're doing for private practices in the UK? So I need to unmute him, so 1 second. Sorry, Sam.
Great, I'm back.
Go for it, yeah.
Give me time to think. Look, honestly, we're back at work. And I think anyone who's not back at work is either being very relaxed or isn't thinking enough about what the future's going to look like, because you need to be ready for it. It's going to take time to implement. And, you know, to many of the points that Miguel raised there, this isn't going back to what we were seeing before. So certainly at Portman, we're at work and we're super busy. We don't know when it's going to open, but for sure we're going to work to make sure that we're ready when it does open. And that's really key. And there are a number of elements to that. So yes, there's PPE, yes, there's SOP, but also there's a psychological component for people, both for your patients and your clinicians who frankly will be nervous about being in practice and treating patients. And you can debate whether that's rational or irrational or high risk or low risk, but frankly, that is the reality, is that people will be nervous. And secondly, your patients will be nervous. And so there's a huge amount of work to do to get ready. In terms of when it's likely to happen, my personal view is it will happen sooner rather than later. It's a key blocker in terms of the amount of calls going into 111, the number of referrals going to urgent dental care. It's a big problem within the hospital network. So it is a key part of the primary care ecosystem. I think they will try and get practices doing some treatments much sooner than people expect. And frankly, why wouldn't you think that? Why wouldn't you be ready? Why wouldn't you assume that it's going to happen? Because you don't want to be left on the bench.
Yeah, thanks, Sam. I'm going to go out on a limb here and say I reckon within the next 5 weeks we should be back to work again in dentistry in the UK. So that's my thoughts on it, but let's see what happens. Okay, just because of time, I'm going to move on to the next one. So what are the best strategies for diary management and trying to get your practice back to the same levels of revenue pre-COVID? So let's kick this one off with Jazz, please.
Sure, thanks. I've been listening, and what everyone's saying, I can't agree with it more, but one of the key strategies that we have found, and it's working really well in this period, is virtual consultations. I'm still doing them. We're still marketing them out there because at the moment marketing costs are very low because everyone stopped marketing. So because of that, we are still marketing. And those patients that are sitting at home, they're spending a lot of time online now. So you've got best of both worlds where those patients that are normally working are spending more time online and marketing costs are low. So we're constantly marketing and we can see these patients coming in for virtual consultations. They absolutely love it, that they're able to speak to a dentist. They can see a dentist. There's some amazing software out there right now where the patients can just take pictures with their smartphone of their own teeth. They'll get a report. They'll get a virtual report instantly of the condition of their teeth. At the virtual consultation, we can discuss that report together. So you talk about the problems that they've got in their mouth. You tell them what we can do for you. But you need to have a full examination, and they can't wait to get booked in. They want to get booked in. So like you said, 4 to 5 weeks, we're currently booking them in sort of mid-June, and we're saying to them that these patients, you may need to be rearranged depending on lockdown. But I believe in exactly what you said there, in the sense that I think we are going to be open in that time. But these patients want to come out. The kind of patients that want to be seen are the ones that have got a want or the ones that have got a need. So the ones that are going to have a need are the ones in pain. So all the ones that we've been triaging, they're in pain, we've been giving them antibiotics, they need to be seen pretty much straight away. So we're going to have a whole list of those patients. We've already got that piled up. We know through our triage system exactly who needs to be seen. We're going to get in touch with them. So yep, we are going to stagger it, but we know exactly who we're going to see. Then we've got the patients that want to be seen because they've got an aesthetic concern. And those are the ones that we're doing virtual consultations with, giving them a report, and then we're doing a full consultation when we see them. And those patients are going to move forward as well. So like I said earlier, we've still got that private income coming through, and we want to be landing on our feet running, because the key thing for me is that if you fail to plan, you're going to plan to fail. So we've got to get all of these, because we've got time now. The last thing you want to be doing is sitting at home doing nothing, like you said, twiddling your thumbs. So try out these systems, see what works. A lot of these systems at the moment, they don't have setup costs. If you start working again, they're going to have setup costs. So at the moment, they're free. So why not use these systems now? Try doing virtual consultations, see how your patients like it, because they're sitting at home. They're going to want to see the dentist. And I think that's going to be the way forward, that when patients are used to this, they're going to want virtual consultations rather than just coming into the dentist. And you're getting them some sort of idea. And then the next step will be an actual consultation in the practice. So I think that's going to be the way forward. Also, do you really think a patient's going to want to come in for a checkup? They're going to only want to come in if they've got a want and a need, and that's gonna correct slowly. It's like Julian said, it's going to be in phases. So yes, it is going to take time for that to happen, but in that interim period, you need to have that private income coming through. Obviously, with me, I've got the NHS coming through, but I want that same, if not more, amount of private income coming through.
No, thanks, Jazz. I think teledentistry is definitely the way forward. And as I think Sam mentioned, America and other countries globally have already taken this into their practices and made it a core element of their practice. And we're having to do it now as a last minute result, but actually we should have done it a long time ago. So it's good that we're having to get thrown in the deep end here. Next, Julian.
Well, I think, to be fair, I think Jazz nailed it, really. So I'm going to bullet.
That's good.
Online consultations, I could not agree with him more. I mean, wherever I go and look, and he's right, there's so much software out there. You can do so much with the patients. I've already made the point about diary flow and phasing patients through the practice. I was intrigued to see one of the questions on the Q&A saying, that I hope Julian's got a massive bank balance to be able to fund what he's proposing. If you look at what I'm proposing, I'm trying to actually dumb this down, not build it up. I think whoever sent the question, and I appreciate the question, I think you need to look at some of the advices out there, and you'll probably find that what we're suggesting is let's not get too overheated about this. The other bit we talk about diary management, longer appointments, so the frequency of attendance for the patient can be reduced. And the other thing is follow up and reminder, review appointments should all be done, if possible, online to avoid the patient having to come back in to the surgery. And then in terms of, and this is a view, and like I said, these are views, a number of dental practices across Europe are setting up rooms for AGP procedures, aerosol generating procedures, with the other rooms being set for checkups and non-AG procedures. And before anyone shoots me for that, instead of using the triple syringe, they use cotton wool and absorbent pads to avoid creating the triple syringe aerosol element. But please bear in mind the point I made earlier about the data saying aerosols are as risky as a cough in the face. Seems to be weigh heavily that aerosols are not as risky. And in terms of the rooms for the aerosol generating procedures, there's a lot of advice there that says if you've got a window, throw it open. which kind of flies in the face of the UDC advice at the moment, which seems to be close the doors. Most other countries are saying throw the windows open and get fresh air in there. If you've got rooms which don't have fresh air, then you can consider, somebody's already mentioned it, air filtration, HEPA filters, etc. Although I wouldn't get too tied up with the you need to kill the virus, etc. There are some HEPA filters out there that are very inexpensive and do an excellent job. You don't need to kill the virus will die in the filter over a period of time anyway. And if you can buy a filter for 300 quid or 260 pounds compared to 5,000 pounds, you may wish to consider that. And the other thing we've got to think about when we talk about, because there were a couple of questions that I was scrolling through briefly in the Q&A where people are saying, you know, the advice is, you know, 3 hours before you can swab down your surgery, the work surfaces in your surgery and see another patient. You need to step back from that. I believe, this is just my view, just step back from that and remember how COVID is primarily transmitted through droplets, which come from deep within the patient's lungs. And the second most active means, apparently, so the data supports of getting COVID is through hand contact. So hand on contaminated surface, hand going into the mouth. But in almost all of the evidence seems to support that you need mucosal contact of the virus to become infected by the virus. So again, I'm not trying to make light of it, I'm trying to be practical. Do you need to clean every surface in your surgery? Do you need UVC robots running around, you know, irradiating your entire building? It's not practical, it's not realistic, and it's not possible. So I think we do have to just slightly step back and take a tiny bit of the heat. And please don't think I'm making light of this. I promise I'm not. But the problem with media and information is that there is a considerable amount of misinformation which is leading to what I call excitable fear. And I'm not for dumbing it down, but I do think we just need to take a deep breath and step back and actually think about some of these things a little bit more carefully.
Thanks, Julian. I think Trump's always calls that fake news, but yeah, I agree. Samir, do you just want to give us the last bit on that, so I can move on for time?
Yeah, absolutely. And just some remarkable things coming out, actually, Jazz and Julian. So, but I think there's just going to be a transitional period in all practices that will be different. Some people will be super prepared. Some people will be wanting to jump in and do the dentistry. Some people will be a little bit more laid back. And that's just the nature of the person that you work for, or the team that you work for, or the group that you work for. And I think it's got to be democratic. Sam made a really good point earlier, just saying we want to have the information, we want to have everything ready so everybody's comfortable. And I like that, because that's absolutely how it should be. You know, one of my partners in Henley said, it's just going to be a different environment. And some people chose to make this a job, but this is a slightly high risk job that we're now in. So this is not the same level of work that we're asking our reception team to do, or our nursing team as well. So it's going to be a transitional period where your team might change, although you've looked after them through the furloughing. And it is important to note that you're not getting all that money back with the furlough. You've still got to pay your taxes and the rest of it. So you've got to put that into your spend pot as well. For the individual owners, it is a little bit misleading, but it's important to understand that. And this transitional period will have longer appointments. It will have reduced number of patients, as we've all said. But actually, if you're performing comprehensive dentistry, and Miguel alluded to this, you'll naturally have lower numbers of people in your practice. And this is absolutely critical moving forward. The highest quality and the highest level of treatments is comprehensive care dentistry, doing often quadrant dentistry, completing an area, doing the right work, taking your time. And actually that means that filling is going to last longer and all the things that go with that. So I think this is the advent of actually better dentistry in the future. And it's something that has already been said, but I wanted to reinforce that.
Yeah, thanks.
The final thing is, sorry, Dev, just one thing is, look, at the moment we're in a period where we're goodwill hunting. There's no money coming in. We're doing the triage and we're looking after our patients and we're goodwill hunting. And it's absolutely a wonderful phrase to use, because for many years, if you're a business owner or you're a dentist, you've just been goodwill hunting. You've done stuff for free. You've taken it on the chin. You've redone it. You've made sure that patient was okay. You opened late. You came in on Saturday. Well, this is what it's all about. And the practices with the most goodwill, the way they've looked after their people in this period, it's how it will be remembered. And I would say we shouldn't go looking for recouping our losses during this period. We should absolutely say this is a transitional period where we look after the people that have looked after us, and those practices will thrive in years to come. And the monies will come in and the businesses will thrive in 2 to 5 years, not in the next 18 months or 24 months.
Thanks, Samir. I'm going to move on to the next one, because I think this is the hot topic that everyone's been messaging about on the Q&A and generally at the moment. So what extra PPE is needed and how will this impact routine dentistry? I know we've touched upon this a few times already. Julian was going to start off this one, and he's going to present 2 slides that he's put together on behalf of Straumann. Thank you to Straumann for this, but I'll let Julian take it over from here.
Okay, thanks, thanks, Dev. So what we've, and it's really important just to make it clear that this is not an authoritative statement. This is a view. It's a view by a collection of people, but nevertheless it is a view. But what we've tried to do is we've tried to break it down into 4 stages. They clearly aren't defined stages, they roll into each other. And the stages are associated with what government decide to do. So stage 1 is clinics opened immediately post-regulation, but nothing much has changed. So you'll have social distancing, you'll have anxiety, you'll have the need for cleaning in the surgeries. Stage 2, will there be we're talking about external to dental practices now. There will be a gradual reduction in the regulations. Social distancing will be maintained, but groups will be allowed to meet. Kids starting going back to school. You know, this stuff is already in the media, but there will be a gradual getting back. And you'll probably have seen, was it last weekend in the paper, they were talking about letting 20 to 30-year-olds get back out into the world. And I think about maybe 10 days ago for that, and about a week ago, there's talk about letting kids get back to school. And of course, if kids get back to school, teachers have to get back to school, parents have to take kids to school, etc. Then you get to stage 3, where social distancing is being relaxed, social meetings are allowed to happen, but mass meetings are still restricted. There is the hope the vaccination program will be advancing, but all the data seems to show that we are a good 12 months plus away from a vaccination. The first set of vaccination trials failed, and so from the person I speak to, who's the senior consultant in infectious diseases at the John Radcliffe Hospital in Oxford, who advises PHE, that statement came from him first thing this morning, so I don't think that would have changed. And then you eventually get to stage 4, and stage 4 I think is really important for us as clinicians, because if restaurants, bars and clubs are open and socializing is going on, then it massively de-risks the risk of going to the dentist, because people have full social contact. Dev, do you want, and these are just guides of stages based on feedback. Now, again, we talk about a guide. And I said, I think in one of the previous questions, singly the most important part of this slide is what I call pre-reception. So this is your triage of the patient before the patient enters the premises. And there are very comprehensive medical screening triage questions that can be asked. You can do it through video, you can do it over the phone. You know, there are a couple of questions on the forum about what happens if the patient forgets to fill something in on their medical history. You can't guess for every eventuality. They could forget to fill in the medical history when they're in the waiting room, you know, in a conventional way. So I think there isn't a foolproof, absolute way of doing this. If you then look at when the patient arrives, the appointments are staggered, hand sanitizers are used by some, temperature cameras. People talk about temperature cameras. You will make your own view on this. You can buy a temperature camera for less than £100. It gives you a red, amber, green. It gives you an idea of whether somebody has a temperature or not. Whether you need it or not is the sort of thing that you must make a decision on. Some people advocate masks for patients. There's very little evidence to support that, apart from the fact it might be a placebo effect. But patients will want to see changes. I think perspex screens for staff in the reception, I think, is an absolute no-brainer. In reception, they verbally confirm the details taken at pre-reception, so maybe that's where you pick up the medical history question. And then everything else, as Jazz was saying, I think it was Jazz was saying, everything else is paperless. No, I think it was Jazz, maybe Miguel, could have been somewhere. It was all good inputs, but everything is electronic. You know, they pay their bills online, the treatment plan is emailed to them, you reduce contact as much as possible. The waiting room recommendation, and I say recommendation based on guidelines, is avoid it if you can. If you've got to use it, strip it out clean, get out your coffee machine and your water machine and your magazine so you can make sure that you clean it. Is there any evidence that air misting disinfection of a waiting room confers any benefit? There's no data that supports that. There is data that supports filters to a degree, but there's nothing on air misting. And then the clinical room, I think everyone can read, so I certainly don't want to insult people by reading out every word, but there is a cleaning protocol. I think we also need to consider the clinical waste, and getting rid of clinical waste will substantially increase. There's an exit protocol procedure for the patient. And importantly, I think one thing, part of the team, and often forgotten, is the cleaner that comes in the evening. And I think, whilst we're talking about having a proper and holistic view to everybody, we do need to include the care of people that come in and clean the surgeries at the end. So, perhaps you might consider that, if your cleaner did do the surgeries, and some do and some don't, that perhaps they should just do common parts, and they should be given, some sort of PPE to make sure that they don't run the risk of touching a contaminated surface. I think, the point I'm trying to make is the cleaner is just as important as every other human being in the practice. Jazz, you want to sort of quickly whiz on to, or is that it?
Yeah, that's great.
So the point is, and Jazz will have this, if you go through stage 1, 2, 3, and 4 that I talked about, by the time you get back to 4, where people are socializing and doing all that, we're back to sort of almost a new normal. So I'm sure if anyone wants it, Dev, you'll share those slides if anyone cares to read them.
Yeah, we'll be uploading this on Dental Circle and be sending it out as well. We can go on to Miguel, just because of time. Sorry, Julian. Miguel, do you want to give us your input, and also a few questions coming through about how can dentists or practices in the UK who obviously do high volume treatments in terms of NHS dentistry somehow afford to have that time extra for disinfection and slow dentistry, as you mentioned before?
Well, thank you. That's the $100 billion question. Do we want to improve dentistry or not? And I want everybody to really, that's watching this, to think about that. Is this the time where we start improving the standards of care? Because everybody has been, we've all been talking about how do dentists protect their jobs. I'm all about how do we improve dentistry for the consumer. I want patients to have a fair chance at the clinic. And I've visited, again, 55 countries professionally. And I know that, in some countries, it's very difficult financially to offer high standards of care. But when we're in a first world industrialized country, I think that a patient has the right pre-COVID to not getting an infection at the dental clinic. And when you have fast turnaround times and it's a single chair or a single practitioner working alone and seeing 25, 30 patients a day, I think that's an insanity. And that's when we created slow dentistry with 4 very basic cornerstones that every single patient can understand. And we promote those to the consumer, which is a signed consent that has explained all of the risks and rewards of the treatment and its costs, waiting till the anesthetic to take its full effect so you don't rush the anesthetic, because when you're in a fast dentistry, sometimes you're doing pain painful treatments to the patient. The third one is a rubber dam on 100% of all root canal procedures and most direct restorations. We say most because it's arguable that some direct restorations, you don't need a rubber dam, but we've spoken to endodontists everywhere on earth, and a rubber dam is an essential tool. There are some studies that show that it can exponentiate aerosols, but not if you have a second set of hands in the room. So we actually advocate that as a safety procedure to the patient. And the last but not least is to correctly disinfect the room in between appointments. You need about 10 minutes. Now that's not 10 minutes of spraying. It's actually to prepare the room, to take off your superficial mask. So to answer one of the questions, we have an FPP2 under a traditional face mask. We change the traditional face mask in between patients. We have a hair protection gear, which we change, and we've just bought full body suits so that are washable. They can go through up to 50 or 60 cycles. We've bought that for everybody on the staff. Everybody got 3 kits. And of course, the shoes that you have in the practice stay in the practice, so on and so forth. We actually published 1 week into the outbreak, and I can share that with you, Dev, 10 steps to success, to successfully disinfect your practice without being too specific. They are not expensive to do, they're easy to implement, and I'm happy to share that link so you can also put that on Dental Circle, Dev. We want safety to be democratic. Because I think that safety is going to be the new thing that patients look for in a dental practice. And let's be clear here. People are practicing very unsafe dentistry. I'm not going to get into the quality of your dentistry, but with high turnaround times in between patients, packed dental waiting rooms, stressful, and not to talk about the impact on mental health. The reason why so many dentists were so stressed was the amount of work that they were digesting a day. And Samir spoke about it. If you're doing volume dentistry, you're not the only person that's benefiting from that is the practice, because it's definitely not the patient, not the dentist, not the hygienist, and most ultimately not the patient. So I think we need to take the pulse of dentistry, what we were doing wrong pre-COVID, and taking advantage of these measures that the whole world now understands the importance of correctly disinfecting. I'm not going to disagree with Julian. I think we can't wear astronaut outfits to work. It's just not practical. But I don't think it's an extra measures of investment. I don't think we need to invest a lot of money. I just think we need to slow down, potentially for the next few months, see fewer patients, improve the quality of our dentistry. And as Samir said, if you're doing better quality dentistry, that's the biggest practice builder on earth. It's not volume dentistry. So I know that volume dentistry might be required for a huge part of the population, but I think that we need to, at the end of the day, take advantage of this COVID outbreak to improve the standards of care for our patients.
Thank you, Miguel. There's going to be some more questions coming through about that, but I want to move on to it during the Q&A. Just because of time, I'm going to move on to the next question on our agenda. So one question I think a lot of owners and groups out there are asking right now is how will practice valuations change post-COVID, which is other billion-dollar question, as Miguel mentioned. So I want to start with Sam because he has to drop off soon. So Sam, do you want to give us your 2 cents, please?
I think it's an excellent question. I honestly don't know the answer. I suppose I come at it from 2 perspectives, which is sort of trying to make the positive case and positive case for continuation and the case for why they might come down. And so I was trying to think about what's made valuations where they are, what's driven those things, and are those going to be sustained? And when I think about that, for me, it's a couple of really important drivers. I think one of which is the fundamentals of the practice. One of them is the fundamentals of the environment, the dental environment we work in. And then one is the economic story. And so when I try and think about the sort of fan of outcomes of, is it likely to go up and be strong or go down and be weaker? You can make cases both ways. But for me, at practice individual level, what are people really buying? They want to know and have confidence in the revenue. They want to have confidence in the profitability. And it's really interesting listening to people talk tonight and read the messages that it's not possible to have a clear view on what profitability will be going forward. So will we need to work slower? Will we need to be four-handed dentistry for all treatments? Will we have more costs from PPE? Will we need to be open for longer and be less efficient? So I think on that particular perspective, very, very difficult to feel confident in what profitability is. And that in its own right just makes it difficult to say, well, I don't even know what profitability is, so I don't even know what valuation I might want to pay for that. So that's an interesting element from there. And then I think when you look at what's driven a lot of the market as a particular dynamic, it's been this consolidation play. So smaller practices rolling up to sort of smaller groups, then becoming middle-sized groups, then becoming bigger groups. And even before Corona hit, there was already a challenge within the market, which is there have been relatively few real success stories of groups at real scale. And there are lots of reasons for that. But one thing we can be sure about is that the equity providers aren't foolish. So they look around the market, they go, who's done really, really well out of this? Who's done, made a success, made a fortune? Who's done great dentistry? Who's done something great for patients? Who's made their backers a lot of money? And truthfully, when you look around the European market, the answer is not very many people. And so that was already having quite a big impact in the market. And those people that read the information on the debt wires and what's going on with some of the public available information can see some real distress in the market. So that bit of the consolidation story, which is, oh, well, you can buy them at this price and sell them for that price, is under quite a lot of pressure for those very specific reasons in the market. But also more generally, because valuations have come off in every sector. So there's almost nowhere where the price today is what it was 3 months ago. That doesn't mean it won't rebound. It could well rebound if we get back to generating the same margins, the same profits, and people get confidence. The final element that I was trying to think through was actually when people put money into dental practice, buy their dental practice, they're thinking about a risk reward. Thinking, I'm going to risk this amount of money. What's the reward that I want for that? And the dynamics that go into that are partly what can I borrow from the bank, and partly how much money do I need to put into this practice, and what do I think I can get as a return. And to me, I think the way investors are thinking about it now is it looks more risky. The thing that I thought was guaranteed, which was this non-ending revenue stream, which was going to make me a profit forever, doesn't look as certain. I want more reward for that. And if that's the case, then the output of that is that valuations will come down. Now, that's a bit of the negative side. That's the sort of downside perspective. I think you can make an argument for why the valuations will continue to be as strong as they were before, why the market continues. And that, of course, is that ultimately the groups are probably in a very good position to drive consumer behavior, to drive many of the things that dentists are crying out for, whether that's investing in talent, investing in digitalization, investing in new ways to communicate with patients and telemedicine. And while that continues to exist, there will be appetite to buy practices, there will be appetite to bring those in. So honestly, my honest answer is I don't know what will happen with valuations. I don't have a crystal ball. But when I think about what's likely to happen versus less likely to happen, I think the range of outcomes is probably that the very strong market we saw pre-corona will be less strong now. But that's just my view, and it'd be great to hear others.
Thank you, Sam. We'll go next to Andy, who is the expert here on valuations, since his company is focusing on that as one of the leading companies in the UK. So, Andy, do you want to give us your thoughts, your two
yeah,
cents?
sure. Cheers, Dev. I was hoping to borrow Sam's crystal ball, but he didn't have one, which was a shame. It's a very tricky time. I'm taking the view that when you stand back and you look at what a valuation is, it falls out of the numbers and the financial performance of the practice. But actually, the financials are the representation of what that practice does. So that's the location it sits in, the sort of dentistry it delivers, its patient base, how it markets itself. None of those things have changed. All those things are still there. there's going to be a delay, and there's going to be a delay for we don't know how long, and that's going to impact on the financial performance of that practice. So there is going to be a recovery. We just don't know when that recovery is going to happen, and it could be 3, 6, 9 months. The demand for practices, based on what people have been saying online and the mood and from talking to colleagues over the last couple of months, is there's a huge demand to still buy dental practices. Because what's happened through this stage, and this is outside of the corporate market, but what's happened is the associates who don't own practices have found themselves between a rock and a hard place, because they earn too much money for local government support, but they're not necessarily in the category where they're so independently wealthy, they don't feel some hardship. So lots of them are seeing acquiring a practice as providing themselves with long-term security for their future. That was broadly the case before the pandemic came along, and I don't see that changing. I think what we're also going to see is an increase in the number of people wanting to sell. There's always a certain number of people who want to sell regardless of the conditions. What we're going through now, I think it's going to be the straw that breaks the camel's back for lots of people. So we're going to have an increased number of people wanting to sell, associates who feel vulnerable from a security point of view that want to buy. And I think there's another issue for associates as well, which is there's the possibility that as we come out of the pandemic, to improve profitability in the short term, if you're a practice owner, what you could do is have a reduced reliance on associates. So you could increase your own clinical days as a principal from 2 to 3 to 4 and not require associates for another few months. That's going to extend the pain for those associates. And it's going to be another reason why they're going to want to improve their long-term security. So where we've got a good supply of practice coming to the market and a large number of buyers, the missing element is funding. And is there going to be money available? Which I think there will be, because the banks are going to need to lend money. They're going to have a mandate from the government to start lending money to improve the economy, because there's a very strong likelihood that we're going to fall into a recession as we come out of the pandemic. Banks are going to want to lend to markets that are low risk and secure, and healthcare has always been one of those markets. So there's no reason why the banks won't support people. In terms of the valuations, yes, there's going to be a period where the financial performance of practices is going to be unknown. It's going to take a period for it to recover. How that impacts on valuations and what people are prepared to pay will pretty much come down to the number of buyers there are in the market and their desire to acquire practice for the long term, because people who buy practices typically own them for between 10 and 12 years. Therefore, I don't think they're going to be making a decision on the financial performance of a practice for a 3 or 6 month period for a 10 to 12 year decision. What may happen for practices, and this may be private practices that have suffered a massive reduction in fees for a short period of time, there may be a valuation based on pre-COVID numbers, but the payment terms may recognise that the fees are down for a period of time. So there may be a deferred consideration that's paid out over a period of time to allow that practice to recover. I must admit, I was hard on listening to Miguel, and Miguel saying about a 10-minute turnaround time, and I have seen his 10 points for decontamination, which is superb, and I'd recommend that everybody has a look at that. But if we can get to a situation where practices are able to turn patients around in an efficient manner, and that can enable them to recover more quickly, which filters through to the finances, we may only see a disturbance in terms of the financials for a 3 or 6 month period. But like Sam said, you know, we're kind of looking into the sky and trying to predict what we think may happen, because we're on uncharted waters.
Thanks, Andy. Gabriella?
I actually think valuations are going to go down in the short term. There is the supply and demand issue. As you say, cash is going to be scarce. People are going to be conserving it and choosing very carefully where to place the cash. Supply is probably going to be higher because there will be more people wanting to sell. Not so sure that people are going to be wanting to invest. And if you just look at the mathematics of a financial model, if it's going to take a while to recover and you move the extra costs and lower revenues for a period of time, you're putting a lot of the value into the terminal value and at the very end of the financial model. So valuations will go down. I think there's going to be a higher supply of practices available. And it has been more of a seller's market for a while, pre-COVID, and it might be a bit more of a buyer's market. And as Sam was saying, if a practice has inherent value, it's always going to fetch a better price than a practice that doesn't. But given the uncertainty right now, you know, the discount rate is just going to have to be higher naturally, because you're taking more of a risk. So I personally think that the valuations are going to go down.
That's some great different views there. I mean, I think the summary really, we're going to go to Julie in a minute as well, but from what I'm hearing is we can use some digital technologies to increase efficiencies, but then because of the amount of patients and volume, that will decrease, and the time for disinfecting the room as well. But at the same time, the supply and demand is out there, and whether we're seeing that now, or maybe that will really filter through after COVID has happened, we might start seeing a drop in demand from the buyers and increase in supply, rather than what we've been seeing for the last probably year and a half, 2 years, where it's kind of been overheated. Julian, do you just want to give us a bit of opinion from the NHS as well? Because I think we've been mentioning a lot about private practices, and it'd be good to see what your thoughts are on NHS practices, where they've got more resilience now as a result of the revenue they've been getting from NHS.
Yeah, I think I'm pretty much with Sam on this, in that I don't know the answer. I don't think anyone does. I would like to, I mean, I've been doing this. I mean, I am first and foremost a dentist. I've done lots of things, but I've been involved in different elements of corporate for a long time. So I've got enough grey hair out of the panel here to be able to look back. And it's quite interesting. 6 to 7 years ago, I just looked at my file. 6 to 7 years ago, multiples were at 5 times EBITDA average. If you look at sort of November, December, it was reaching the heady heights of 8, or ask for 8, 9, and 10 with a bit of creative license from some of the people putting them on the market. But the really interesting thing is how the valuations were based. And in my 30 years of knowing this, what seldom went into a valuation, which was a major flaw in valuation, was the condition of the practice at sale. So brokers and individuals will sell practices based on a multiple of EBITDA, whether in a 4-chair practice, the chairs and the equipment is 5 years old or 35 years old. And of course, that is a significant challenge, because you can't just base it on turnover. You have to look at where you get your return on investment as a buyer. Whether you're a corporate or whether you're an associate buying a practice, it doesn't make any difference. If you are going to spend £1, you need to know that you're going to get £1.20 back. It's business. You don't ever spend £1. Nobody spends £1 in the hope that they get 90 pence back, because that's just being a busy fool. So I think the reality is you need to look at return on investment. I think Andy made some very valid points about, what happens to the practice. We'll see a dip. How long do the performance figures stay dip? What does it look like? How quickly do they come out of recovery? What impact does video consultation make, etc.? So I think you'll be looking at practices which become attractive because they have understood what's going on and learned how to embrace it and move forward. So there are lots of very, very bright dentists out there who will know how to engage with their patients and build their businesses back. Sam, I think Sam made a point, Andy made a point. What is clear, and I talk to the banks on a very regular basis. And in fact, I did a round robin on Thursday, Friday, and today for most of the big dental lending banks. And the truth is the banks are very nervous. Debt will become debt. I know that the government can say what they like about they must lend. They won't also shore up the balance sheets of the banks. So it's easy to make political gain on the telly by saying, we've told them to lend, but it's a bit like me telling you how to do your dentistry. You're politely going to, or not politely, going to tell me to mind my own business. So what's happened with those businesses that are equity backed, and it's the equity backed businesses that have caused this escalation in multiple with a frenzied buying, and I know because I did some of that when I was in Oasis, is what you've got a situation where the equity investment now has to be greater. Previously, private equity would leverage the purchase price by balancing it with debt at least 50-50. You're not going to see that going forward, which means then that equity money will be more expensive, and therefore they will need to look more carefully at the return on the investment they get when they look at how much money they've put in. So we're going to go into a phase where even at sort of circa 0% interest for normal bank lending, equity investment is going to need a coupon. And I think that will slow up acquisition by corporate groups. I think, so I'm agreeing with Gabriella on the point. I think corporate groups, whoever you are, will be far more selective and far more challenging in the way they look at whether they get the return on the investment, because the cost of their money will be higher. And I think if you're an associate wanting to get out of being an associate, you know, there are also challenges in running your own practice, because there isn't any education in dental school about how you run dental practices. So overall, fundamentally, I think valuations will go down on the whole. There will be the exceptions that prove the rule, because there are some quite exceptional practices and practitioners out there who will achieve, you know, very good prices when they come to sell. But we're going to go through a period of uncertainty, and taking Andy's point, when you buy something, you got to base it on a valuation that isn't you sticking your thumb in the air and guessing. It's actually born out of what can be reasonably achieved in terms of investment, in terms of recovery of investment. That's broadly where I am.
Just just very quickly then. So do you feel that entrance practice with a contract that's got that resilient kind of, you know, income coming in even now and going forward would potentially get a higher multiple than you would do for a private practice, where over the last probably 2 or 3 years they've always become equal because of both of the pros and cons? Do you see that kind of having a bit of a bigger difference now, or do you feel that it's still going to be roughly the same decrease in evaluation of both of them alike?
I think it'll be. Was that directed at me?
Yeah, Julian. Sorry, just while you're.
Like personally, I think the valuation will be based on the quality of the practice and the quality of the practitioner and the stability of the associate and the practice. There are many factors that go into an acquisition. You know, what anybody wants to do when they buy an associate, you know, an associate friendly, associate driven, if you like, practice with principle, is they want to see stability. They want to have seen investment. They want to understand that the practice is a good practice to buy. Nobody wants to buy a practice where the associates in the practice have all only been there for 3 or 4 months, and the ones before that were only there for 3 or 4 months. So it's not as simple as gross income and purported EBITDA. And quite often we'll see, particularly from people selling practices, that they will play around with the EBITDA figure to say, well, if you owned it, you could do this. And the question I always ask is, well, if we should have done that, why hasn't the owner done that? You know, to go like Del Boy and Rodney, for those of you that, you know, are over the age of 50, you'll understand that, you know, if somebody purports that it could have been done, the question I always ask is, well, if it's that good an opportunity, why didn't you do it yourself? And there's usually a reason why not. So it depends on your profile. You know, the NHS has stability, but it's a low profit model. Private dentistry is slightly better, but you've got to look at the fact that costs of running private practices are higher. If you look at NASDA, the National Association of Dental Accountants, there isn't a huge difference at associate level between a private associate EBITDA and an NHS associate EBITDA, taking into effect the cost lines and lab fees and seeing fewer patients, etc., etc. So like, it's multifactorial. But I think the days of just plucking a massive price out of the sky for anybody and purporting that there's 20 people looking at it, so you better rush to buy it, I think that will stop, and I think the lending institutions will become far more careful about where they back it. There was an interesting question on the forum where somebody had written, I had to be careful. Did I understand the term between cash flow and liquidity? And it's a very good question. The answer is I do understand the difference between cash flow and liquidity. I've been doing this 30 years. And what I meant, just to be clear, is I'm not talking about 30% of practices that appear to be struggling on a liquidity basis because their cash flow is negative. I'm talking about people that are completely overgeared in every aspect of their life. And it isn't cash flow, it's their entire debt portfolio that is pulling them down. And I'm talking to a lot of dentists at the moment who live hand to mouth, month to month. And when something unexpected, because this hasn't happened in 100 years, happens, there is no fat and there is no contingency for them to be able to fight their way out of it. And I feel very sorry because they've gone into this bubble of dentistry, is a wonderful business, and it is. But, my parting comment on this is have a reality check and look at your spending. We don't know whether COVID's going to bounce again. There's always a possibility we could see a second bounce. So cut your cloth accordingly, rein in a little, put a bit of fat in there. There's some great comments from Miguel, great comments from Samir about, the ethics about how you work and how you want to be as a dentist. Those are the things that I would focus on. But, would I have the third holiday in Corfu, or would I put it in the bank? I'd probably put it in the bank at this stage.
Yeah, thanks, Julian. And just because of time, I'm going to move on to the last question now, which I think is also another really key kind of question everyone's been asking. So if just for everyone's kind of knowledge, if they weren't aware of this before from the audience, recruitment was a big issue across the UK from all kind of areas of dentistry, from nursing to dentists to hygienists, maybe because of a number of dental professionals being graduating through the institutions across the country. And I mean, from a group perspective, I think that was everyone's fighting over the same kind of the same bunch of people who are looking for jobs. So it was very difficult. Do we see that changing now because of COVID? And if we do, will it get better or worse? And what is everyone's thoughts on it? So Sam, do you want to kick this one off, please? Sorry, you muted again. Sorry about that. Go for it.
I think, in all honesty, the providers that have a true value proposition to clinicians will thrive, and those that are not focused on how to look after their clinicians will struggle. So I think it's going to be a very interesting market where there's a polarization of what people expect from their dentistry. I think it's interesting to listen to how Miguel thinks about dentistry, and whether people view that as how they want to build their careers. So I think there will be a huge change in terms of recruitment, but I think people will have very different experience with it. And I think those dentists who historically have had very cushy deals and been able to drive very strong positions with their providers will find that they really need to show what they can bring to the practice and how they can help the practice. So I think that dynamic's going to change really quite a lot.
Yeah, I think you're completely right. There's going to be a big change, even hopefully, from the level of work ethic. Just from our network of dentists, obviously, with over 8,000 young dentists on our network who are under the age of 35, we did a survey, and most of them wanted to do private, no NHS, and work less days per week. We're talking about half the week even sometimes. And that was what they wanted to do. And I think now they're realizing that it's not going to be feasible to be doing that. And I think there's been a huge generation shift on maybe millennials, and I am one of them, so it's fine. But even I was working full time when I was working clinically. So yeah, it's a crazy way of kind of thinking. And, even when we're talking to young dentists, it was really a big challenge for them to understand how to kind of, give back to the practice. But I think now there's going to be a big shift in that kind of momentum of, potentially, hopefully there'll be an easier pool of recruitment rather than difficulty. Let's hear from Gabriella on your thoughts from Bupa.
I agree with Sam. As happens with most things in life, when things are going well, you don't see the true nature of things, but when things are going badly, it's much easier to differentiate those who are truly engaging, living their values and trying to be a people-centered organization where people can have a career and develop over a long period of time, and those that don't and are just focusing on other things. So there has been, I think people will have seen that And I think what people value will change. You know, Julian has mentioned it several times that there are people who have overstretched, or who just expected the industry to continue and not a once in a 100-year event coming and hitting us. And, you know, I still remember a finance professor in business school who said, you know, the way to survive in this world is always to worry and think about what could go wrong and be prepared for it. So it's always good to have that in the back pocket. For us, obviously, you know, we consider to think, you know, we continue to think that dentistry is a great business. Obviously, we are here for the long term, and we think the dynamics are going to change, but we're continuing to recruit right now. How we're doing it obviously is different, and having to adapt to people not being able to visit practices, things taking longer, etc. But our focus is very much on the one hand, taking care of our people and making sure that they feel safe and that they have a future here, and then continuing to build on that future because of our perspective. But I do think preferences, how people approach what they're looking for, and what they want is going to change.
Yeah, great point. I mean, one of the things that I've always been very keen on is really trying to show what's different about your practice to your associates, and things that Sam mentioned, like training and mentoring is really key for their growth, but also giving them the technology and digital capabilities to do the best dentistry possible and not push them towards doing the wrong dentistry by volume and more on quality control. And finally, you know, I think recruitment has always been very simple, where, you know, when I graduated, it was always like a forum. You go on there, you have a BDS degree, you get a job, and you don't even go there until you kind of just got a job before you even went there. I think now we have to start using stuff like videos of practice tours, of showing them what we're going to work for, the quality of your practice, meet them 10 minutes of the team, testimony videos. That will start really putting yourself out there and really showing your practice, hopefully standing out. Because even though we've got this, you know, the recruitment hopefully will get better, and there's still a huge number of practices out there looking for practices, good dentists all the time. And I think to get the best ones, you really need to be above the crowd and showing the values as well as a group. So next, Andy, do you want to give us some of your thoughts on that?
Yeah, I mean, one of the things we look at when we value practices is the length of service of people in the practice, both clinicians and the support team, because I think that tells you a huge amount about the culture and how that practice operates. If you've got a team changing every 3, 4, 5 months, there's something fundamentally wrong in that business. So I think making sure that there's a long-standing team really matters. I think Gabriella said it, I think Sam said it, culture and values is going to be massive. I think as we come out of this, there's strong leadership and practices are running away, which is culturally strong. I think you're going to retain good people. Jack Welch does a great piece on values, where he's got a grid of A, B, C, and D. And it's all about people performing and do they get your values? And if people get your values, you can work with them, and normally through training, you can improve their performance. If they don't get your values, at some point, I think you're going to end up parting company. And as we come out of the pandemic, I think having people who really get your vision and are working and pulling inward with you to try and improve the performance is going to be critical. I do think that there's going to be some availability of staff. I don't think it's going to be as scarce as it was pre-COVID times. But if practices bounce back and get to their pre-COVID performance levels within 9 to 12 months, I think people within dentistry all could and should be fully employed again.
Thank you. And last but not least, Julian, maybe from the NHS point of view.
Well, I don't know why you keep saying NHS, because I'm an entirely private practitioner.
I mean, from my dentist point of view, should I say?
Listen, I was just tongue in cheek, as time is a ticking. I think the answer again is we don't know. There's, you know, a lot of financial pain being felt by a lot of people. There's a lot of uncertainty in the associate world. What I do think is technology will play a part. And I think that if you're an associate, you may be attracted to a practice that embraces technology, embraces video consultation. But I also think technology will play a part in the devolution of the workload in the practice. So take, for example, one of the leaders in this at the moment is, as I mentioned before, is Korea and to a degree some areas in China. where, and I use the word sales unashamedly because we're not talking about illness here, we're talking about cosmetic procedures or elective procedures, where they've embraced video consultation. There's something like a 38% increase in the sales of aligners attracting implant patients over video communication carried out by well-educated TCOs, nurses, receptionists. In other words, other people will be used to draw patients in. Of course, you will still need dentists in there, but that plays to the second bit, which is, you know, in my life, I've seen many dentist CVs, and moving forward, what will not be attractive to me, if I was looking at associate, is what I call a CV of a butterfly. Somebody who jumps from practice to practice or group to group, always thinking that grass will be greener on the other side. I think those associates will struggle more, and I think you touched on that kind of in your intro there, Dev. And I think the other thing that people will look in a diminished patient volume world is the associate's commitment to postgraduate education and pursuit of excellence themselves. I think if you are an associate and you're happy to come out of dental school these days, you know, with your BDS or your LDS and think that's it, you will be less attractive in the new world. It's very simple, because as technology changes, as the aesthetic requirements of patients changed, you need the operator to be able to understand golden proportion and aesthetics and, you know, the proper ways of doing implants and the proper ways of doing aligners and all this kind of stuff and basic dentistry. You know, if you want to get to where Miguel is and Samir, these are guys that are, you know, right at the top of the food chain in terms of what they do. And I don't mean that disrespectfully, guys. They do that by a commitment to excellence. And, you know, if you're looking to buy your own practice, and here's the other interesting challenge, because what you said, Dev, is when people, you know, your generation of dentists kind of want the work-life balance more than my generation did. When I graduated, you know, I used to work 6 days a week, you know, 8 to 10 hours a day. We get associates now who only want to work 2 to 3 days because they want their own me time. And I totally get that. You can't run a practice on 3 days a week and my me time because you can't afford it. So there's a whole flux of stuff that's going to change, some for the good. But I think if you're an associate moving forward, commitment to yourself, get your work-life balance right. Don't be a butterfly. It doesn't really matter where you work, and look for places that can offer you a career, you know, independent or private. I'm not selling anything here. You know, it's about the quality of your life when you get in that 10x6 room. You know, you've got to make sure you enjoy it. You've got to make sure that you embrace technology and you're a mover and a shaker, not somebody who drags themselves to work, you know, and spends all their money on the Ferrari they can't afford, really.
Thanks, Julian. And yeah, very good advice there. All right, we're going to move on to the Q&A. Just before we move on to that, this is a summary of the 5 stages of the COVID crisis, which we put on Dental Circle as well. So you can download that afterwards from the website, but just a nice summary of some of the key points to really think about now and going forward. In terms of questions we've got 5 or 6 key ones here. The first one we're going to ask, which I think is quite a key one, which I don't think we really kind of touched on, is quite a touchy subject, which I'm going to ask to probably Sam first, just from his point of view. What are your thoughts on how we can factor in the cost of PPE and the increased amount of decontamination and time required, in fact, to keep profitability high and a business running still? I mean, do you have any ideas on that right now? Is it going to be passed on to the associates, onto the patients? What are your thoughts on that? Just going to unmute you again, so go for it.
Look, I think that's a really interesting question. I think it's one part of the Rubik's Cube that everyone is trying to solve, which is the cost of running a practice is going up. It's a question of how is that funded? And clearly, if you're in the NHS section of the market, you'll be looking to the NHS to provide that to you. Right now, it's quite clear that you should be using FFP3 masks if you can get hold of them. those are incredibly expensive, and if they're available at all. So I think there are different stages. I think in the initial stage, there will be a debate around who should pay and what should be provided. And in many cases, I think the ability for private practice will be to pass some of those costs on to patients. Maybe the practice will pick up some of the costs. Maybe the associate will have to pick up some of those costs. The answer to that isn't yet solved. And I think that's a really challenging one for everybody to answer. And as we move into sort of more normal phase of the coronavirus and the input costs come down, maybe it will fall almost entirely onto the patient. And my personal view, and I think Miguel touched on it before, and actually there's some good evidence coming out of Jeffries, is that patients want to know that they're safe. They want to see it, they want to feel it, they want to see clinicians in full PPE. And where you do that, the patients will engage much more quickly. So my personal view is that we will be in an environment where there are many more costs. And one of the many conundrums is going to be, how are those costs paid? I don't think anyone has the answers yet. So I'd be intrigued to hear what others say.
Julian, do you just want to give us two things? One, because I know we discussed it before anyway, FPP3 versus FPP2 and N95. What's your thoughts on that, and globally, what you're seeing there? And secondly, how do you feel the NHS or NHS dentists will be able to, or practices, should I say, will be able to essentially cover these extra costs that we all know we have to do for our patients, for our teams, and for our staff to protect them and keep them safe? But there's no extra costs given to us, or no extra money given to us on the NHS. Is that going to lead to a reduction in UDAs delivered per year? What's your kind of input from that, from what you've been hearing?
Well, I kind of hate that question because there's no perfect answer to that one. So, of course, Sam is correct. You know, if you look at the NHS guidelines, and we're not just talking about the NHS, we're just talking about patients. For aerosol generating procedures, the recommendation is FFP3. But here lies the challenge. Regardless of what the recommendation is, there aren't any. Right? We own Dental Directory as a business. We can't get them in Dental Directory. And we can't get them because they've been earmarked for the NHS, quite understandably, the police force, and lots of other ancillary, government businesses. The reality is, you can make as many recommendations as you like. The practicality is that if you can't get them, you can't get them. So I think that's the biggest single challenge. And of course, the answer is you can always get something at a price. So on the black market at the moment, FFP3 masks, again, we monitor this, they're going from anything from £11.50 a mask to £40 a mask. Okay. Now, I don't know about you, but that's not possible in any sphere. If you then add the recommendation of fluid resistant gowns for aerosol generating procedures, even if you put an FFP2 just with the fluid gown, that's £38 per patient if you gown the operator and the nurse. So these are monumentally big challenges that all practices that do this will face. Somebody mentioned whether the NHS will pay the PPE. There is no indication presently that the NHS will increase funding to PPE. The question's been asked. I'm not saying they won't do it, but there hasn't been an answer. Because the reality is, it would cost hundreds of millions of pounds to step up from standard masks alone just to FFP2. I mean, literally hundreds of millions of pounds on the current pricing. So it is a huge challenge. If you look at, let's come back to why masks, right? So if you look at N95s, N95 simply mean filtration level of 95% or above. FFP2s are 94% or above. FFP3s are 99% or above. So a good fitting FFP2 can be between 94 and 99% filtration. So they afford better protection than standard dental masks. And I think therefore, because we won't have FFP3s available, even if we wanted them and even if we could afford them, you need to come back to the absolute fundamental basics of trying to de-risk the patients you're seeing in the first place by putting in robust triage in your practices. You know, and don't forget, at the end of all this, we actually want to have all got it and all our patients to have had it, because we don't actually want to be here again. You know, that's the brutal reality. This is a delaying tactic. This is not a let's keep it in isolation, because if we keep it in isolation, all the experts say there will be a rebound. And what the last thing we need is to be having this conversation next year. So I think what's going to happen is you're going to need to take a practical and pragmatic approach to an almost unfathomable problem.
Thanks, Julian. Next question for Jazz. What companies do you recommend for video consultation appointments, and what do you use at the moment?
That's a great question. As soon as I mentioned that comment, I think it was about half an hour ago, my phone wouldn't stop buzzing. This dentist wanted to know which company I use. So I thought that question might come up. But the one, I did research quite a few. The one I recommend is, the one that I'm using right now is the one called SmileMate. And they're the ones where the patient can take photographs of their own teeth using their smartphone. And they would load that on. Those photos come to me along with a report. I would look at the report and then share that with the patient. And then we would have a virtual consultation. It works beautifully, it's simple, and patients love it. Thanks,
Jazz. Just so everyone knows, SmileMate is available from Dental Monitoring as a company, so you can have a look at that afterwards. Next question. This is a question for anyone who wants to take a stab at this. Do you think we should be testing patients at the practice for COVID? And if so, how would we do that and budget for that? Who wants to take that one on? Samir, is that hands up for you? Yeah, okay. 1 second. So unmute you. Go for it.
So I think one of the things that we've spoken about is how we're going to get back to work. And there are a number of sort of interesting people, doctors, dentists speaking about this. And I spoke to a doctor today called Priya, who's married to a dentist, and she's got a really keen view on how we should take care of this. And the screening part of getting back to normal dentistry that Julian mentioned is absolutely critical. So the people that we want to treat the people that need dentistry, that are safe to be treated, that reduces risk. Everyday life is about reducing risk. So therefore, I think somebody mentioned a day before we called. No, because then we can't create a book and a feasible sort of a day book. So therefore, they're run 3 to 5 days before. And on the back of that, they're filtered through. Do you have any of these problems? No. If anything happens during that period, please call us. And then when they come in, they have an antibody test. And that antibody test would include the IgG, IgM. And a lot of the original tests were done with Chinese antibodies. And therefore, all of the tests that are being done in Oxford and Cambridge at the moment are actually using British antibodies. So therefore, we're going to have quite a good antibody system very soon. We're talking about starting in June, so this is fantastic. It'll be ready for us to do a very simple, cost-effective antibody test and test if that person is safe to treat. And don't forget that the actual chance of you getting COVID, it's all about the viral load increasing and your susceptibility. Now, as a dentist, we're susceptible to all of these many infectious diseases on a day-to-day basis. And I think in general, we have a high immune response to most things. So therefore, if we're excluding a lot of the risk and then we're getting back to work with FFP3 mask with 11 hours on top of us and wearing that 14-hour mask for the day, I think that's actually reducing risk and allowing us to go back to work and create an environment that's what we call a modified PPE. Now, creating a full PPE, which we spoke about as being £38, that's absolutely ludicrous. And all of these simpler ways to get back to work, they're actually very practical ways, the way we should be getting back to work, getting on looking after our patients. At the end of the day, I think that's what we all want to do in a safe manner, that's looking after our staff, our patients and ourselves. So it's actually probably a 4 or 5 step operation in this. And I think what the future will be, this will actually get categorized. This is what we have to do. This is how we're going to do it. And then that will allow us to get back to work.
Thanks, Samir. Anyone else want to add to that from the panel? No? Okay then. Next question is actually for Miguel. So as you can imagine, everyone's on the call, most of them do NHS dentistry. And they're asking, how can we justify the costs of dentistry when we're doing UDAs, which are obviously part of the contract? Do you want to have a stab at that, please?
Yeah, so just for the record, the views I'm about to express on my own, I don't represent, I have no shares in any company, any stocks in any company. And I was quoted in a lecture I gave in Argentina in 2008, where I said, finance-based diagnostics is killing dentistry. And I've been saying that repeatedly in my lecture circuit for the best part of the last 12 years. It's resonated a lot with high-end practitioners, and it hasn't with people that basically practice finance before dentistry. We've heard a lot of that here today, and I understand that there's a huge business in the DSO business model, but Julian explained it. If you've got into dentistry to make money right now, even in the current times you live in, if that's your sole objective, then I think you made a bad life choice. And to hear people that want to get into dentistry and have work-life balance of 3 days, that's just insane. I mean, it's insane, and I don't care who that offends. There's other jobs that are out there. Nobody puts a gun to somebody's head and says, go to dental school. And that's not what dentistry is about. We're primary care physicians. We've been fighting for a place at the table as primary care physicians. We are physicians of the oral cavity. We are much more than just people that make pretty teeth. We're much more than that. Doing bad interventions, doing bad quality dentistry can lead to overall massive decreases in your immune system, in your psyche, we know that. There's a direct correlation. So I get a little bit nervous when I start seeing people that are more focused on the money filter. So when the government comes in, I'm not just saying the NHS, comes in and says, this is what you have to do. And then all of the beautiful science and scientific evidence, the latest scientific evidence that says in order to do these certain protocols with quality, the science says that this is how you have to do it. But the government says you have to filter it through this. Whatever comes out the other end isn't dentistry. I'm sorry, but it's not. It's something else. Now, you can call it whatever you want, but it isn't what I'm learning, and it isn't what top tier dentists around the world are talking about. So why is there this huge disconnect between what the top dentists, scientists, and investigation and clinical evidence out there saying, this is what we want you to do. The top digital dentists in the world are saying, this is what we want you to do. The top implant, everybody's saying, this is what you need. But then you come to the NHS and it's a whole different ballgame. So I don't know enough about it. I've never practiced on the NHS, and my heart goes out to all the people that have these these conditions where they have to literally hit these targets and stuff. But it isn't just on the NHS. It's in a lot of the DSO models in the US as well, where they have specific numbers that they have to, these financial targets. And I think that, again, we have to review, and we probably have to slow down a little bit and put the patient first. And if dentists collectively can't come forward and say, I'm not going to do that. I'm not going to do a root canal without a rubber dam. I'm not going to practice unsafe dentistry. And everything people said here, I agree with. I don't think we have to wear an astronaut outfit. I think we have to find very simple safety measures. I hope Julian's right that in time we can go back to practicing the way we did before. But what is before? If before means that you're seeing a patient every 15 minutes to do, drill, fill, pay the bill dentistry, I'm profoundly against that now. Till the day I retire, I'm going to fight that kind of dentistry. So You know, there's always going to be a place for that. But let's think about it this way. What's the difference between a 2-star motel and a 5-star hotel that's got every single award, that's won every single award? They both have a service. They provide a bed, a door, they have a shower, soap, a bath, a toilet, so on and so forth. The difference is in the level of service, the difference in the quality of everything. But if on face value, it's pretty much the same thing. I just don't think that we should sell to the end consumer that it's all the same, because it's not. And I think perhaps what we need to understand here is that at the end of the day, it's the consumer that's going to dictate who he wants to go to. So let's not mix everything in the same bag, because what Samir's doing, what Jaswinder's doing, you know, what the high level and what everybody's trying to talk about here is that it's the consumer that's going to dictate what he can afford and where he wants to go. But I don't want to be mixed, and I know millions or hundreds of thousands of dentists around the world don't want to be mixed up with that. And to answer your question on the NHS, I really don't have an answer, but I lectured for the BDA about 4 years ago, 5 years ago, and I was starting to talk about slow dentistry already and about the turnaround times, and everybody was saying, but the NHS is 15 minutes. Now, I don't know if that's true or not, but I was pretty shocked, because I started going through all of the dental procedures in my head that I could do. And I have a bit of experience in dentistry. I don't think I could do it. So now you've got dentists that have been 3 or 4 years in their profession, given this very short time slot with the added aggravation of hitting financial targets and now COVID on top of it. I think we're going to have mental health issues like we've never had before. I think the quality of dentistry coming out is going to be worse. And at the end of the day, it's going to put a burden on the NHS 5-6 years down the line to repeat all of the bad work that was done under these conditions. So I think that if you step back and look at what's been going on in the last 10 years, how can we fix that? I don't practice on the NHS, but I think people need to look at this and fix, what can we fix moving forward? I come from a country, I practice in Portugal, there's only one system, it's private. And you can or cannot afford, and people try and find a practitioner that they can afford. You know, not everybody needs cosmetic dentistry, not everybody needs implants. I've always said it, if you've got a healthy oral cavity and a denture, that's great dentistry, because it gives people back their dignity, capacity to chew, go out and get a job. And I wish you all the best, and maybe one day you can afford better dentistry or implants, so on and so forth. But to have this 2-tier system where you have private and then a government, I never learned that at school. So I can't really opine on that. I can't have an opinion on that, but there's not a dental book on earth, and I challenge anybody to present it to me, that says that you have a time slot with which to do a specific treatment. And moreover, we need to start analyzing that younger dentists need a little bit more time to do their job calmly and without stress. UK has one of the highest rates of doctors suicide and of doctors being sued. Why? Come on, we need to fix this. And it's now, let's use this pandemic to fix this. And I'm just saying, the only way forward is not extra investment, it's seeing fewer patients. And the public also, I hope the public are watching this, stop brushing your teeth. Stop eating so much sugar. Stop flossing a little bit more. We've been selling this for 100 years. If you show up in a dental practice wanting the government to pay for your dentistry and you haven't washed your teeth in 20 years, I'm sorry, you're not eligible. We have to, I don't care who that offends. People have to be responsible for their actions. Dentists, the public, there has to be an ecosystem here. So if you go to a fully private country, much like my own, if you can't afford dentistry, you walk around without teeth. You know, the government, they've never had a role to play with that. And I think it's fantastic that, I'm happy that tax money goes to help those that need it. I think that primary care dentistry should definitely be part of this, of the NHS. But more complex things, I don't know if you can afford it. I don't know if you ever had. And that's why you've made the time frames so short. And I just hope that moving forward, you can find a way to help these young men and women that are working really hard, that passionately believe in quality dentistry. They need to pay bills, and they're not given the right amount of time or conditions to do their job properly. And I just really hope there's a solution.
Miguel, it's a little bit cultural within this country that actually the NHS is there, and it's a really tough one. And I can see you're really passionate, but unfortunately, the hand that we've been sort of dealt is as it is. I think the shortfall is not actually the NHS, because the NHS is actually doing some really good basic work. It's the poor dentistry that's provided by the NHS providers, who they're selling as private, that's of poor quality. and they're trying to charge out. That's where the actual criminalness is, in my view.
I didn't want to
because
go.
actually, if you're at the top end in a fully private practice and you're doing your work and you're trying to put some good stuff out, great. It's actually the poorly construed sales of an NHS practice trying to put work into the private load, and it's not done at the level that it should have been done at. And that's where actually self-training and the motivation and the growth could improve. And that will be the education of the patients. So actually, what a great place, what a great difference that was. And that customer service, the quality of material, I think that's where the shortfall will be. And the movement will be slow, unfortunately, in this country, because there is that 3-tier system. But, you know, unfortunately, we are fortunate to have the NHS, but it's that second bit that we just need to change. And the quality of work that's being done in private practice and in mixed practices.
I couldn't agree with you more. I couldn't agree with you more. I didn't want to put my finger in that, but I'm really glad you did, because obviously anywhere in the world you have the less ethical. But I can tell anybody watching this right now, anywhere around the world, I lectured on this at the Midwinter in Chicago in February. And my final slide was basically, they asked, how can artificial intelligence help? And I can tell you right now that in Palo Alto, there are people working on artificial intelligence, working with insurance companies. They are finding tens of millions of dollars of fraud every single month, because now they can actually cross-reference everything. So I think that it's going to be a very short leap into the future, the next 4, 5, 6 years, that we have artificial intelligence coming into our systems to understand if there's been mismanagement on behalf of the practitioner. I think that will help the DSOs. I think that help the corporate dentists, making sure that there's better oversight. So I think that dentists really need to shape up and start practicing better dentistry. And nobody under any circumstances is obliged to do bad dentistry. They can stand up, walk out, quit, and get a job somewhere else. You know, there's rules about, there's a textbook of what works in dentistry. It's called science. It's not finance. We don't study finance. We study science. We study dentistry. And I just really think that we all owe it to our patients to improve our game around the world.
Thanks, Miguel. Sorry to cut you in, guys. We're running out of time, and we've already gone an hour late here. So I just want to wrap things up. But thanks for everyone's input from the panel, and thank you all for participating tonight. I know it's been a very good discussion, and we've got some great insights, I think. Just so all the audience knows, we've got obviously sponsors who've been helping the network over the years, and we want to thank them all for being part of our network and also helping our members. Without them, as I think Sam mentioned earlier, this industry wouldn't be the same as it is, and a lot of them are very high quality, and that's why we work with them. So thanks to our sponsors. Last but not least, Miguel's top 10 tips, the COVID 5 steps back to work again, the Straumann presentation that Julian has put together with Straumann, that will all be available on Dental Circle free of charge as a resource. So just log on there and go to COVID-19, the top left corner. You can download it free of charge. We'll be uploading more content and more resources on there to help out the industry, and hoping that we can all kind of get back together stronger and better than before. But yeah, thanks for all your help today, everyone. And yeah, I just want to thank the panel, especially for all their great comments. Also, the last thing is the recording of the webinar will be available on the website as well, on Dental Circle and on social media, which will be recording and posting out soon, okay? If you missed it. Thank you, everyone.
Cheers, all.